The Wegovy pill just got FDA approved and it's already changing everything about weight loss. No needles, same results. But there's a catch nobody's talking about. I'm Dr. Fadul, and in the next 10 minutes, I'm going to show you everything you need to know about this breakthrough medication. By the end, you'll know exactly how effective it is, who should take it, and whether it might be your answer. Here's what we're covering. First, the science behind how it works. Then the pill versus injection comparison. We'll also cover the exact morning routine you need to follow and the 5 keys to success that most people miss. Here's what's really interesting. This pill comes with strict rules that could make or break your results. But first, hit that subscribe button and turn on notifications because I'm breaking down useful health content every single week. Okay, let's dive in and talk about what this pill actually is. The Wegovy pill is an oral version of semaglutide, the same ingredient in the Wegovy injection. This is huge because it's the first oral GLP-1 medication specifically designed for weight loss. Here's the science made simple. Semaglutide mimics a hormone your body already makes called GLP-1. This hormone does 3 things. First, it tells your brain, I'm full, stop eating. So you naturally eat fewer calories without feeling hungry. Second, it slows down how fast food leaves your stomach. So you stay satisfied for hours instead of feeling hungry after 30 minutes. Third, it helps stabilize your blood sugar, which stops those energy crashes that make you reach for snacks. Now you might be wondering, if it's the same ingredient as the injection, does it work just as well? The clinical trial data is about to surprise you. But before we get to those numbers, let me show you something that shocked even the researchers. Okay, let's talk numbers. But before I show you these results, I need to tell you something important. What I'm about to share is based on peer-reviewed research published in the New England Journal of Medicine and submitted to the FDA. This isn't internet hype, this is hard science. And the results are better than most people expect. In the OASIS 4 trial, researchers tested this pill on adults with obesity. After 15 months, here's what happened. People taking the 25 milligram pill lost an average of 13.6% of their body weight. The placebo group lost only 2.2%. Let me put that in perspective. If you weigh 220 pounds and lose 13.6%, you're losing almost 30 pounds. That's sustained significant fat loss. But here's what's really impressive. 76% lost at least 5%, the threshold doctors consider clinically meaningful for improving health. 60% lost at least 10% of body fat, a game changer for health outcomes. 28%, more than 1 in 4 people, lost 20% or more of their starting weight. 1 in 4 people lost 1/5 of their body weight. That is transformational. The injectable Wegovy showed a 14.9% average weight loss. So the pill is just as effective just without the needles. But these results only happen if you take the medication correctly. That's where most people mess up, and that's what we're building towards throughout this video. Stay with me. Let me break down the real differences because this is about your lifestyle. Dosing. The injection is once a week. You pick your day, inject yourself, done. The pill, every single morning, no skipping. How you take it. The injection goes under your skin. The pill you swallow with water. But there's a catch. Strict timing rules apply. And I'm going to walk you through those in just a moment. Storage. The injection needs refrigeration initially. The pill is easy, room temperature storage, and it's a breeze to travel with. Cost. The pill is cheaper if you're paying cash with drug discount coupons. Starting dose runs about $150 a month. Maintenance is about $300. The injection costs about $350 a month. If you hate needles and can commit to a strict morning routine, the pill is perfect. If you want once a week convenience, go with the shot. Both work equally well for weight loss. Now here's where most people fail with the pill, and the next section is absolutely critical. This section could literally determine whether this medication works for you. Pay close attention. The Wegovy pill has ultra-specific instructions. This is straight from the prescribing information I review with every patient in my practice. Step 1, take the pill first thing when you wake up. Your stomach must be completely empty. Nothing to eat or drink except water for at least 6 hours before. Step 2, swallow it whole with no more than 4 ounces of plain water. That's about half a glass. Not coffee, not juice, plain water only. Step 3, do not crush, chew, break, or dissolve the tablet. And step 4, wait at least 30 minutes before you eat, drink anything else, or take any other medications. Now, this might sound extreme, but here's why the FDA requires this. Oral semaglutide has terrible absorption in your gut. Less than 1 to 2% of the pill actually enters your bloodstream. Food, coffee, other medications, they all interfere with that tiny window of absorption. Once you get into the routine, it becomes automatic. Think of it like brushing your teeth. Pro tip, keep your pills on your nightstand. Set an alarm 30 minutes before you normally wake up. Take the pill, go back to sleep. When you wake up for real, you can eat breakfast right away. Remember, this is a key number 1 in our success system we're building. Strict adherence to this morning routine is non-negotiable. For me, I like my coffee right when I get up, so this would not work, but everybody can make their own decisions. Life happens. If you miss a dose, simple rule, skip it. Don't take 2 pills the next day, just take your regular dose the following morning. If you miss 1 week or more, call your doctor before restarting. You might need to drop back to a lower dose. Now about side effects, I'm not going to sugarcoat this. They're real, but most are manageable and improve over time. The most common issues are digestive, nausea, which is the big one, diarrhea, vomiting, constipation, stomach pain, heartburn, bloating, headache, fatigue. In clinical trials, 80% of people reported some GI issue, but most were mild to moderate and improved over time. Only 7% quit because of side effects. Nausea is usually worse during the first few weeks or when you increase your dose, just like the shot. Best management, smaller meals, avoid fatty foods, stay hydrated, and give your body time to adjust. For most people, it gets much better after the first month. Call your doctor or head to the ER if you experience severe, sharp stomach pain, swelling of the face, lips, or throat, difficulty breathing, sudden vision changes, a lump in your neck or persistent hoarseness, or thoughts of suicide or severe depression. Be on the lookout for any decreased urination or severe leg swelling as well. These serious side effects are rare, but trust your gut if something feels seriously wrong. Now, before we get to the 5 keys to success, there's one critical thing that could make this medication dangerous for you if you're not aware. Let's talk about drug interactions. Let's talk about medications that don't play well with Wegovy. Diabetes medications. If you're taking insulin or pills like glipizide, combining with Wegovy can cause dangerously low blood sugar. Your doctor should adjust your diabetes medications. Other GLP-1 medications. Never take Wegovy with Ozempic, Rybelsus, Trulicity, Victoza, Saxenda, or Mounjaro. You'd be doubling up on the same drug, causing severe side effects. Thyroid medication. Wegovy might affect levothyroxine absorption. Your doctor should monitor thyroid levels more closely. Blood thinners. Warfarin absorption can be affected. Don't forget, you can't take any other oral medications for 30 minutes after your Wegovy pill. Now, about Rybelsus. I get asked constantly, aren't they the same? Short answer, no. Both are oral semaglutide pills, but designed for very different purposes. Rybelsus is for type 2 diabetes. Maximum dose is 14 milligrams. It's designed to lower your blood sugar. The Wegovy pill is for weight loss. Maximum dose is 25 milligrams, almost double. It's specifically formulated to maximize weight loss. Same active ingredient, different doses, different purposes. Never take them together. Now here's what separates people who lose 5% from people who lose 20% or more. These are the 5 keys to success. What separates people isn't just luck. We're building your complete success system right now. Key number 1, strict adherence to your morning routine. Remember that morning routine we just talked about? This is where it becomes critical. The data is clear. People who miss doses lose significantly less weight. Only about 27% of patients stay truly adherent with daily oral medications. That means 73% of people aren't taking correctly and wondering why they're just not getting results. You must take the pill first thing on an empty stomach with a 30-minute wait. Set an alarm. Keep it on your nightstand. Consistency determines results. That's key number 1. Now let's talk about key number 2. Researchers found that patients who eat adequate protein, at least 25 to 30 grams per meal, preserve muscle mass while losing fat. Here's why this matters. When you lose weight without protein, about 1/3 comes from your muscle. With proper protein, you lose primarily fat. That's the difference between looking skeletal and looking fit. Eat smaller portions. This medication reduces appetite naturally. Focus on lean proteins, vegetables, and healthy fats. You can check out my video on protein intake linked above. That's key number 2 in our success system. Now, key number 3. Clinical research shows that adding exercise to this medication creates additive effects. Aim for 150 minutes of moderate aerobic activity weekly, just 30 minutes, 5 days a week. Add strength training 2 to 3 times weekly, even if it's just for 20 to 30 minutes. Why strength training? It preserves lean muscle you need for long-term metabolism. People who exercise while on semaglutide lose fat preferentially and maintain their energy. If you're unsure where to start for exercise, check the video linked above for guidance. That's key number 3. We're building your complete system here. Key number 4 is healthcare support and regular monitoring. This is often overlooked, but it's critical. People who work with healthcare providers who monitor them monthly lose significantly more weight. Why? Because when a provider checks in, you stay accountable. They adjust your dose for side effects. They counsel you on nutrition. They troubleshoot problems. Real-world data shows consistent provider support leads to 5 to 10% better weight loss outcomes. That's key number 4. And now the final key. Key number 5 is mental and emotional readiness. Hard truth, this medication isn't permanent. About 2/3 of people discontinue within the first year. Many regain weight after stopping. I have a complete video on keeping the weight off after GLP-1s. That card should be appearing now. Watch it after this one. The people who succeed see the medication as a tool to build new habits, new eating patterns, new routines, new mindset. They use it to create sustainable change, not magic cure expectations. Building healthy habits is key for success, and I break that down in the video linked above. The bottom line, patients with ideal medication adherence lose an average of 15.6% of body weight in 12 months. Patients with poor adherence, less than 5%. Same medication, completely different results. That's your complete 5 key success system. And that's why finding the right healthcare partner matters so much. Quick question before we wrap up. Drop a comment right now and tell me, are you leaning towards the pill or the injection? And what's your biggest concern about starting? I read every comment and I'll respond to your questions personally. All right, let's bring this all together with your action plan. Let's recap. The Wegovy pill is the first oral GLP-1 medication specifically for weight loss. It works by reducing appetite, keeping you full, and regulating blood sugar. People lost 13 to 14% of body weight over 15 months, matching the injection. It requires a strict morning routine. Empty stomach, water, wait 30 minutes. Side effects are mostly digestive, usually mild, and improve with time. Success comes from 5 keys: strict adherence, proper nutrition, exercise, healthcare support, and mental readiness. Here's what you really need to understand. Effective weight loss is never just about medication. The doctors who get the best results monitor everything: your progress, side effects, energy, blood work, overall well-being. They're partners in your transformation. When this works, and it does for most people, the transformation goes beyond the scale. People feel more energized, rediscover confidence, and take control of their health in a sustainable way. If you're looking for that kind of attention to detail and care, you're welcome to join my practice at Bespoke Concierge MD. We're here nationwide, offering personalized weight management that treats you as an individual. Whether you choose the pill, injection, or other treatments, we create a plan that fits your life goals and unique situation. We don't just hand you a prescription, we provide ongoing monitoring, side effect management, nutrition guidance, and one-on-one support every step of the way. From initial assessment to dosing adjustments to celebrating victories, we're with you. Your weight loss journey is too important to leave to chance. If you've been struggling or want expert guidance on whether Wegovy is right for you, don't waste another week feeling stuck. The link to schedule a consultation is in the description below. Take action today. Remember, knowledge is power and your health is absolutely worth fighting for. Thanks for investing 10 minutes of your time in your health. And hit subscribe. I publish evidence-based medical content every week that could change your life. Now here's what I need you to do. If this information helped you, share this video with someone who needs it. Someone in your life is struggling with their weight right now, feeling hopeless, blaming themselves. Your share could be the difference between them getting help and suffering in silence for another year. If you're not sure where to start, the video on the right describes the Metabolic Health Assessment we offer. The playlist on the left covers GLP-1 medications, their benefits, and related topics in detail.